I really feel like I broke my patient's heart the other day when I told her that despite her pregnancy now being over and her gestational diabetes technically being resolved, she still has an increased risk of developing type 2 diabetes later in life. Up to a third of patients who have gestational diabetes still have impaired glucose tolerance in the postpartum period, probably likely because some of those patients were actually pre-diabetic or diabetic prior to pregnancy, but we didn't catch it until their actual pregnancy. But even if you didn't have diabetes before, you have a much increased risk now later in life of developing type 2 diabetes. Your risk of developing type 2 diabetes is 7-fold higher than the patient who didn't have gestational diabetes, and you have up to a 70% chance of developing type 2 diabetes by about 28 years postpartum. It's so important to do that dreaded 2-hour glucose tolerance test in the postpartum period. It's going to tell you if you have impaired glucose metabolism or diabetes. But even if you don't now, lifelong you have that increased risk. So it's really important that you talk to your primary care doctor and get your A1C checked every some years, especially later on in life, because of that increased risk.